Toronto Public Health is sending out more than 18,000 letters to families with high school age students, urging them to get their kids' immunizations up to date. This as TPH says that vaccine rates have fallen well below pre-pandemic levels.
The goal here is to send individualized letters home to students who are in grade 11, who were born in 2008, to get them up to date, and if they're not up to date, they will face suspension.
The COVID-19 pandemic disrupted both school-based vaccination programs and those administered by primary care providers, leaving many students behind.
Current grade 11 and 12s were most impacted by the pandemic because they did not get to have any or complete their school-based vaccinations because they were in grade 7 and 8 during the pandemic. So the current grade 11s who we are assessing, they didn't have any school-based programs. And so they missed that important meningococcal vaccination that you get in grade 7. We also know that these high school students are to get a booster at 14 to 16 years of age. And many of them may have missed it or may not have realized that they need it because of the pandemic.
Toronto Public Health says low vaccination rates aren't just due to students skipping vaccines. It's also because parents need to proactively update their children's immunization records. Vaccination records must be reported to Toronto Public Health, which can be done through its website. The Immunization of School Pupils Act requires students to be vaccinated for several diseases, including pertussis, also known as whooping cough.
These are part of routine vaccinations. We know that these vaccination rates were very high before the pandemic, and so we know parents understood the importance of them and that they were safe vaccines. And we've seen now, because of lagging vaccination, we've actually seen an uptick in some of these diseases. So whooping cough is one of the vaccines that we give as teenagers, and we've seen a rise in whooping cough cases this year.
The letters have been sent out, and now it's on parents to ensure their kids' vaccination records are updated. TPH says more information is available on its website, or parents can contact their family doctor to find out next steps. With vaccination rates for diseases like the measles dropping to 70% and at least 64 cases reported last year, Toronto Public Health says the time to act is now before more preventable outbreaks hit our schools and communities even harder. In Toronto, I'm Rowe for City News.